Paris, pregnant people are now officially recommended to receive the COVID-19 vaccine. Two leading organizations in obstetric care have released this recommendation after hearing feedback from tens of thousands of vaccinated pregnant people. This comes as the Delta variant is causing a spike in cases, and those who are pregnant face an increased risk of developing severe COVID. Joining us now with more are Dr. Priya Rajan, Associate Professor of Maternal Fetal Medicine at Northwestern Medicine, and Dr. Carmen Adams, Attending Physician at Cook County Health in the Department of Obstetrics and Gynecology. Doctors, welcome both of you, and thanks for joining us. Dr. Rajan, let's start with you first, please. What do we know about why both the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine, why are they making this recommendation?
I think there's a few different reasons that this recommendation is coming out now. One is that we've known for some time now that pregnant women who get COVID-19 infection get sicker than the general population. They fall into that higher risk category with higher rates of needing ICU care, ventilatory support, sometimes as extreme as something called ECMO. They have higher rates of premature delivery, sometimes because the pregnant person's status is deteriorating, and so premature infants, higher rates of cesarean delivery. So in general, having COVID-19 infection, particularly if you have any of the other comorbidities that have been associated with a higher risk of developing severe infection, obesity, cardiac disease, anything like that, result in higher risk for you to be very sick and your pregnancy to potentially be sick. There's some data that suggests that the placentas are also affected by that infection. So I think that's one aspect of it. The other aspect of it is that the safety data that we've received so far has been very reassuring. So nearly 140,000 women that have registered through the BeSafe system. There's been no safety signal to suggest an increased risk of miscarriage or birth defects or premature delivery in any of those patients. There is also some preliminary data suggesting that there's efficacy of the vaccine in pregnant populations. So the vaccine works to prevent infection in these patients. And then there's very preliminary data suggesting that we can see antibody levels in cord blood and breast milk, suggesting that there is at least a possibility, based on what we know of other vaccines, that there may be some neonatal protection against COVID-19.
So it sounds like a lot of data there. Dr. Adams, you're an expert, but you yourself were also pregnant during one of your COVID shots. How did you make that decision for yourself?
Yeah, so I had the opportunity to get the vaccine pretty early, and I was at the end of my pregnancy, and I had a discussion with my healthcare provider as well as some of my work colleagues, and really just thought about the risk and benefits. Again, knowing that pregnant women that get COVID are more susceptible to severe disease, and knowing that I am at a higher risk being a Black female and having some other medical conditions that put me at a higher risk category. I knew that if I were to get COVID, I could get really sick. And so it made sense to get the vaccine from that perspective. I got my first dose when I was towards the end, about 2 weeks before I delivered, and then my second dose about a week postpartum.
So it sounds like for you then, the risk, of course, of getting COVID outweighed, the risk of some unknown from the vaccine.
Exactly. And what we, the only vaccines that we don't really recommend in pregnancy are those that are live viruses. And so it made sense that there would be little risk with this vaccine.
So according to the CDC, pregnant Asian people have the highest vaccine coverage at 33% getting one dose. On the other end of that spectrum, though, pregnant Black people are at the lowest with a 10%. Dr. Adams, why does this gap exist?
I think it's multifactorial. I think that I think a lot of my Black patients have some mistrust of the medical community, and that's based on a lot of things that have happened in the past. And those concerns are definitely valid. And my responsibility is to talk about the safety of the vaccine. And I like to talk to them about my own personal story as well, and how I chose to get the vaccine. and remind them that these vaccines were studied in a very diverse patient population. And so there were Black women included in these studies. And so they were well represented in these trials.
And of course, this news about vaccinating pregnant women, this comes as COVID cases are on the rise. Dr. Rajan, why are pregnant people at a higher risk for severe COVID?
So I don't think we know for sure, but there's a few factors that may play a role in it. Pregnancy is a time where your immune system is a little bit suppressed. And so that may be part of the factor that we're seeing. We also know that there's physiologic changes to the way your respiratory system works and your lungs can kind of expand. Those may play a role in it. There may also be additional factors that we're not identifying. I think sometimes hesitancy to treat or to identify illness in pregnancy can sometimes be part of the issue. So hesitancy to give the same treatments or use the same imaging techniques may delay diagnoses in pregnant women that may contribute to them becoming more sick. I think all of those may play a role in why pregnant women get more severe illness, but it's similar to what we see in other infections, for instance, influenza.
And Dr. Adams, we've got about 45 seconds left, but what are some of the concerns that you're hearing from patients who are hesitant regarding their concerns about risks for their fetus?
Right. So patients will bring up several different concerns, mostly regarding their concern about miscarriage or having a stillbirth or having an early delivery and preterm delivery. And I really try to talk to them about the data that we've collected since we started vaccinating women, and that has not shown to be the case, and there hasn't been any increased risk in developing any of those complications in pregnant patients that have received the vaccine.
Okay, so some myths that have to be dispelled there, it sounds like.
Exactly.
My thanks to Dr. Rajan and Dr. Adams for joining us.
Thank you for having us.
Thank you for having me.